If you have an interest in horses and love learning more about horses, the horse industry, teaching, or even managing your own horse business, then you're in the right place. We would love you to join us on our mission, which is to improve the lives of horses around the world through the education of riders, handlers, and trainers. So get comfortable, listen in, and enjoy.
Today's chat's been sponsored by Online Horse College. If you'd like to enrol in a horse course that's government accredited and internationally recognised, then have a look at the wide variety of equine courses at Online Horse College. Simply go to onlinehorsecollege.com and click on your area of interest. Our chat today is with Dr. Kirsten Jackson. Dr. Kirsten Jackson is a vet. She studied veterinary. She's also an equine vet, which is why we're having her on the show. And she's also specialised in dentistry, and she's going to tell us a little bit more about how she's done that while we're on the show, and hopefully talk to us about some problems and give us a little bit more information about potential problems our horse might have to do with their teeth and mouth and those sorts of areas. Now, how are you today, Kirsten?
I'm very well. Yeah, thanks very much for having me.
Oh, that's okay. Thanks for coming on. I think our listeners are going to appreciate your expertise in this area. I think it's really good of you to spend the time with us, so thank you.
Yeah, no problem. Always happy to, spread the word on dentistry, something we're pretty passionate about.
Okay, now we normally have a favourite quote. Now, have you got something that you would normally say to someone, just about horses' teeth, something that you say to yourself, something that's been a bit inspirational? Have you got anything at all like that?
Oh, I don't know.
I've thrown you in the deep end, haven't I?
Yeah.
Sorry.
That's all right. I mean, I don't know about a favourite quote, but I'd certainly say that, horses are very good at hiding pain. And so, just because there's no pain doesn't mean, or no signs doesn't necessarily mean there's not a problem.
I think that's a really good tip for anyone as well. Yep. So thanks for that. Now, I'm sort of thinking about when you first started with horses, your memories, experience, but putting it in with, was it at that stage that you wanted to be a vet? Because a lot of young girls want to be a vet. They have a bit of an affinity with animals, and all the relatives come around and go, oh, isn't she so good with animals? She's going to be a vet, not thinking that there's a lot more to being a vet than just liking animals.
Definitely, yeah. I've actually got a video of me at the end of year 12 saying that I could never be a vet.
Really?
Because I wasn't sure that I'd be able to deal with putting animals down, actually, to be honest. I've always been pretty passionate about animal welfare, and I knew that obviously at times that it's a part of the job, having to euthanize animals, and I wasn't sure I'd be able to deal with that. And I, as I say, I wasn't sure I'd be able to do it, and I took a year off actually after high school and just trained horses actually for a year.
Did you?
And just sort of really thought about what I wanted to do and whether I thought I would be able to sort of handle it and do it. And obviously came to the conclusion that the one thing that I am really passionate about and have always been is animals. And, I just really had to do something that I could, where I could sort of follow that passion. And, I guess it's sort of, a good friend or colleague now, Dr. Warwick Vale actually said to me, the only people that ever make money out of horses are vets and farriers. So, pick one of those. And that was kind of, I don't know, I'd quite agree with that anymore, but it's, I think it's something where, it's been really, I'm very, very glad that I have done that. And now it's sort of, I guess one of the great things about dentistry as well is that, I'm not really euthanizing animals anymore. I haven't euthanized an animal in, 8.5 years now, which is very nice. So I can sort of use that veterinary degree, and then sort of you can sort of go off on in different areas of interest, but it makes a really, really strong foundation of knowledge to then sort of go down the path that your area where you're interested in. So
yeah. And obviously an equine veterinarian, because you had that background with horses rather than just the dogs and cats. It's really the horses that you wanted to help.
Yeah, I think going through vet school, everyone else, people would always ask, what sort of vet do you want to be? And for me, the question, originally was more, what sort of job with horses do I want? What type of vet do I want to be? So I was pretty sure from the start that was where I was going to end up. And I went straight into general equine practice from graduating, and then I went into dentistry after that. So horses have always been a pretty strong.
I think the person that told you about vets and farriers. I think I was told that as well. But I think the horse industry's expanded so much. You know, it really has. The last each decade, it just expands more and more and more. And there's so many people and so many areas within the horse industry, so many jobs within the horse industry, and you don't have to. Yeah,
which didn't exist a lot of a lot of the courses that didn't exist 15 years ago.
That's right.
So,
yeah, for sure.
Yeah.
Now you're there, you're a vet, okay, and you're working with horses, and you're an equine vet. Why dentistry? You know, was there something that you particularly liked about the dentistry, or was there problem horses? Or tell us a bit about that.
Yeah, so I mean, I think if you told me, before I started vet that I was going to end up in horse dentistry, I would have absolutely laughed at you. It was certainly wasn't something that started off as an area of interest. But as I worked as a normal equine vet for 2 years, and we did quite a lot of dentistry within that, and I just started to notice, I'd have horses coming in, and I'd ask the owners, are they having any problems? Is there any signs of any discomfort? And the owners say, no, everything's fine. No problems riding wise, no problems eating. And then you'd open the mouth, and you'd see these horrific ulcerations or fractured teeth, dead, infected, abscess teeth, and the horses would just go on and just deal with that pain. And I think again having that background of that real passion for animal welfare, I just saw it as an area that was really often ignored, and horses were often, as I say, just forced to deal with this horrific pain because you can't see it. I think that's the thing. If a horse had a big wound anywhere else in the body, you'd see it and you'd do something about it, but they can have horrific wounds in their mouth and the owners can't see it, and so they often go untreated. And so that was something where, as I say, I also just find it really fascinating, and particularly as I've got more and more involved in it, and I've done a lot of education over in Europe, and doing some pretty cool stuff these days with doing fillings and root canals and all that sort of thing. So it's not just a matter of rasping off some sharp teeth anymore. And so it's sort of fascinating in itself. But as I say, I think for me, just that being able to make such a big impact on animal welfare by sort of highlighting and treating this hidden pain, I tell a lot of people, like if you had a toothache yourself, like, would your work colleagues necessarily know about it? Like, you'd still get on, you'd still go to work, you'd still do your job. You might just chew your food on the other side, but that doesn't mean it's not painful. And I think that's what, so many horses, are just constantly dealing with. And it's just really, rewarding to be able to, do something about that and help these horses.
Yeah. Do you have, like, within your practice, do you work with another vet? So say people might get another vet for all their normal horse health problems and then call you in as the equine dentistry specialist. Is that the way it works?
Yes. So I don't do a lot of general equine veterinary stuff. I'm happy to advise clients, and often while I'm there, to do the teeth, they'll say, oh, can you have a quick look at this, or what do you think about this skin lump or something? And I'll often have a look, but if it's, but I will usually send them back to their normal veterinarian for most things. Because, it's sort of, as they, for the last 8.5 years, I've done a lot of continuing education, but it's pretty much all been in dentistry. So I have a very strong opinion that, if I'm, I want the best thing for that horse, and if I'm not necessarily the best person for that horse, or to be able to sort of help that horse, then I'm more than happy to send it to someone that is more sort of experienced in that area or more qualified in that area. So I say I do a little bit of other veterinary sort of stuff, and obviously I'm trained in it, and obviously worked as a normal horse vet for over 2 years. But I'd always, the horse always comes first basically, and it'll always do what I feel is best for that horse. So so no, plenty of other equine veterinarians around that are happy to sort of do the colics and the lamenesses.
Yes. Now you talked, among other things, the fact that you haven't put a horse down for a long time, and you've talked about lots of benefits. But if you're going to pick out one thing about the best thing about being an equine vet who specialises in dentistry, what would you say?
There are definitely a lot of benefits, and as I say, the main thing for me is I just find it fascinating, and it's it's an area that has grown in terms of research in like exponentially in the last 10 years. Like 10, 15 years ago, you would never see a journal article on equine dentistry, or very rarely, whereas now, half of the equine veterinary journals are dentistry, and it's such an emerging field, and I find that really exciting that there is so much new information out there, and being able to keep up to date, and just that there's always new things. There's always people trying new things. There's some guys in Europe that are extracting teeth and then sort of chopping the end off, doing a root canal and then re-implanting the tooth inside horses' mouths, and all this sort of amazing stuff. And I find that, I feel very privileged to be sort of in an industry where we can sort of be part of that. And sort of might talk about it later, but we're also doing research as well ourselves, into a condition that's really common in Western Australia, a form of dental decay. And so, again, being able to contribute to that body of knowledge and being able to sort of help progress our knowledge and help more horses then internationally, that, if we can figure out what's causing this condition and then be able to sort of help even more horses is fantastic. So, that is definitely the main thing that I absolutely love about it. One of the other benefits is that horses don't tend to get toothaches at 3 o'clock in the morning, so we don't tend to get quite so many after hours calls and emergencies. You do get the odd fractured tooth that certainly needs to be seen pretty soon, but even that can usually wait until the next day. It's sort of so not too many calls at 3 o'clock in the morning. So definitely a benefit.
Okay. Now, tell me this, and it's almost like I know the answer, but I'm going to ask it anyway, because I'm sure there's lots of other people that don't know the answer. But do all horses need to get their horse done? And just tell us that. And because if they do need to get them done, what would be the signs of a problem if they're, what would make it? Or what could people see if they needed to get them done?
So basically every horse should have their teeth done at least once a year. Younger horses, so younger than sort of 6 or 7, would usually say every 6 months, because their teeth are quite soft, so they get worn down more quickly and get the sharp points more quickly. And again, in the older horses, like sort of over 20, they often will end up needing to be seen sooner, or if there's problems, we'll need to see them sooner. Some signs that you might see. Certainly eating-wise, you might see them dropping food, or sort of the chewed-up balls of hay around the feed bins, might be eating a bit more slowly, or sometimes when you watch them eat, they'll kind of stop and sort of stretch their jaw like they're trying to fish food out with their tongue, fish food out from between their teeth, and that can be a sign of periodontal disease, which is where they have food getting stuck between the teeth, and that rots in there and causes a really nasty infection. So that's sort of some things you might see eating-wise. Riding-wise, you might see some bit resistance or head tossing, particularly when you're putting pressure on the contact. It might be a bit of a head tilt or reluctance to go one way. Some of them can be quite severe, bolting, bucking, rearing, all sorts of things to try and get away from the pain. I've even had one horse that just his whole temperament changed. He was sort of, I guess, a fairly assertive horse anyway, but basically started to become really aggressive and dangerous, and the owners were actually considering euthanasia, but they hadn't had his teeth done for a few years and thought, we'll just rule that out. And he had massive hooks at the back of his mouth that were cutting a huge hole in the roof of his mouth. So every time he closed his mouth, it was just literally, cutting a hole in his mouth. So we've reduced the hooks, and he went back to being normal again. So just every horse is different in the signs that they'll show you, but I think probably the most important thing, the most common sign of dental disease is absolutely no sign at all. And I think, we need to remember that horses are prey animals, and they are really good at hiding pain. If they're out in the wild and, there's a wolf there and they're sort of sitting there not able, not chewing their food properly and losing weight and that sort of thing, they're obviously going to get picked off pretty quickly. So they deal to just, learn to just deal with it and chew on the other side, or, compensate. And it's often by the time they're showing signs, it's often, quite severe pathology going on there. And the idea, I think the dentistry has changed a lot, in that, again, 10 years ago, we used to almost, grasp off a few sharp points, and if there was a problem, then we'd deal with it. Whereas, it's so much more about preventative dentistry these days, and doing a really thorough examination. So, we sedate the horse so that we can have a proper look in there with a light and a mirror. We look at every tooth. and between every tooth, because the signs of the most serious dental conditions, so things like a dead infected abscess tooth, the only thing that you will see in the mouth is literally like the tooth normally has sort of 5 brown dots on there, and they'll be kind of like a dark brown, almost black. And that's literally the difference between a dead tooth and a live, healthy tooth. And so you can imagine how easy it is to miss that if people are just sort of going in there and having a quick feel with their fingers. You will not pick up. And that's the sort of thing, that dead, infected abscess tooth will often end up, the infection can often burst into the sinus, you end up with a sinus infection, and a lot more sort of serious complications. Whereas if we can do that thorough exam earlier and pick these things up and, deal with it, do something about it, then we can often prevent these, problems from becoming big problems. And same with periodontal disease. So when they have those, the gaps between the teeth and food getting stuck in those gaps, if we get onto it early, we clean out the food, we disinfect it, we often will pack antibiotics into the pockets and address the cause to try and figure out why the food's getting stuck in there, if it's got a big overgrowth opposite it or something like that, and we can treat that. And if we get onto it early, we can save, so many more teeth, whereas, again, 10 years ago, we just sort of ignore it and then wait until the tooth was loose and then have to, pull out all the teeth. So, really nice these days that we can, if we do that thorough exam, we pick up these problems early. Then we can prevent it, and it's also taking that pain away, because periodontal disease is a very painful condition as well. So if we can treat it, obviously make the horse happier and healthier, but also preventing them from losing their teeth early, so we can hopefully keep them with a good mouth up well into their 20s, if not later, if not 30s. So
Yep. I'm just thinking then, if we can't see the signs, we've really got to write that in our diary or calendar or something, and just when you come out, then go, right, it's either 6 months or 12 months, and it's just something that we've got to be thinking of in advance. Oh, right, next month I've got to get my horse's teeth checked.
Yeah, we usually book people in at the time for their next appointment.
Yeah, well, that's probably good. It's good business sense, but it's good equine welfare sense as well.
Yeah, definitely. And also sort of peace of mind. Otherwise, if your horse, if you're doing your dressage test and your horse is throwing their head around, you're going to be sort of thinking, could it be the teeth? Whereas if no, they've been regularly done, we know that's, and you've had a good look and a feeling there yourself. I think that's the other side of it is, make sure that whoever you're using, just ask if you can have a good look in there. And I say it's amazing what you can see. With a good light and, a sedated horse and a good speculum, you should be able to see all of the teeth back there. You should be able to see all of the oral structures to the cheeks and the tongue. And, and I say, and really need to get in there with a mirror so we can really closely examine the teeth and between the teeth to find those problems. And, if you've got a good dental technician, dental vet, then they should be able to show you this and let you have a feel and all that sort of thing. And I think if you can get involved, it really it helps you understand what's going on.
If you're an equestrian coach or a horse riding instructor, or even if you aspire to be one, have a look at the free video series for horse riding instructors on the Horse Chats website. Go there now, have a look. horsechats.com. So if someone, just say, even to your younger self, you're at school and you just thought, I'm never going to be a vet, or, what would you say if you said, I want to get into the industry, but I'm just not sure how? Is it a matter of just simply going to uni, being a vet, and then doing some postgrad work, or have you got particular advice for someone who'd like to get into this area of the horse industry?
I mean, I think definitely investing in, quality education is definitely, a really good idea. I think that can make a big difference. There are, everyone sort of wants to work in an area that they're passionate about. So I think you sort of need, it's worth spending the time on a good quality, course for a quality education to, really sort of give you that sort of head start. And I say, for me, certainly the veterinary, having that veterinary background has just made such a difference. And it really does give you just a much more in-depth idea of what's going on. I mean, you sort of learn everything from sort of biochemical level through to the cell level, through to the body systems level, and then the sort of whole body as a whole. And, it just really gives you a much better understanding of what's sort of going on in there and can really help. Because a lot of the time things aren't sort of isolated, that a problem in one area may show up in other areas as well. And I think having that sort of really good education, that strong background behind you is definitely really a really good thing. And I think, I'd also sort of recommend to people just like you never stop learning and always keep an open mind. There are a lot of people out there that have a lot of experience, and sometimes the words of wisdom might come from the most unexpected sort of person or unexpected sort of area. And I think always keep an open mind and keep never stop learning. But I think having a good solid base to start from is definitely will really sort of help propel you in the industry.
Yeah, and I think that just generally goes right across the industry, doesn't it? It's because if you can come out of school, everyone wants to come out of school and just become the top rider or the top person or whatever, but you've got to start there. And the other thing is too, you get the education and the qualifications, and as an employer, if there's two people and you're not quite sure which one, you go, well, I'm going to get the one with, it's not just having the qualifications, but it's the personality type that's gone out there, got the qualifications, they're the one that are more open-minded, more ready for progress, more ready to do something for themselves. So it's sort of showing your employer that that's the type of person you are. You're ready to put yourself out there and learn more. No,
definitely. I think it is very, very, very important to get out there and learn and just sort of look into the places where you're learning from and make sure that it's reputable and just get out there and learn from quality places.
Good. I'm glad you said that because, we sort of go back to the RTO that I suppose, provides all the sponsorship for Horse Chat. So, that's sort of a good recommendation for people there as well. All right. Now, tell us, you've been doing some research. Tell us about the research. Like you've already said, you really like the quality education, you really like having an open mind and expanding your ideas. But what particular research are you doing? Why did you start it? And tell us a bit more about it.
So I actually kind of fell into this research project. I basically have a huge problem with a condition called peripheral caries, or basically tooth decay in Western Australia, and my own horse actually has had it. He had it. I've had him since he was 5, and he's now 24. So had him, but growing up, I just kept getting told he's just got terrible teeth. He's just got genetically really bad teeth. We don't know what it is. Basically, there's nothing we can do about it. And then when I sort of got into dentistry, obviously I was doing his teeth, and the more horses that I saw, it was just such a common condition. Like in the research, the prevalence has come out at almost 60%. So when you're seeing a condition in 60% of your patients and you have no idea what's causing it, is very frustrating, and especially as a veterinarian. Not being able to really treat or, help your patients was really awful. So I actually just contacted a friend of a friend who was a human dentist, and I just literally just said, oh, look, we've got this huge problem, sent them some photos, said, what do you think this could be? And he said, well, actually, he didn't say it, but he's actually turned out that he's like the head of research in his dental research organisation at UWA, and said, well, why don't you find out? And so that was how it all started. And so basically we did a survey of 500 horses trying to look for risk factors for the condition. And we looked at everything. We went from management, so even down to like riding regime or what discipline they did, obviously signalment, so age and breed and gender, that sort of thing. And then obviously looked at diet in a huge amount of detail, also sort of how they were living, do they have access to pasture and grazing and that sort of thing, and what even soil type, pasture type, water source, all sorts of things, just try and think of anything and everything that could possibly be related. And and we did come with some quite interesting results. So we found that breed was significant. So thoroughbreds were significantly more likely to have peripheral caries than Western breeds and warm bloods. The hay source was also highly significant. So horses on oat and hay were almost 3 times more likely to have peripheral caries than those not on oat and hay, and those on meadow hay were less than half as likely. And we're now sort of going beyond that and trying to sort of figure out, well, what is it in the hay? And we believe it's to do with the sugar content, that oat and hay has quite a high level of water-soluble carbohydrate, or basically sugar in it, and we believe that's likely the problem. So we're trying to sort of look further into that at the moment. But anyway, the water source was also significant. So horses on bore water were actually least likely, which was interesting.
Yep.
And then followed by scheme water, and then rainwater, and then dam water. And we sort of looked into that, and it turns out rainwater is actually quite acidic. The critical pH where horses' teeth are cemented, or on the outside layer of horses' teeth will start to decay, is only 6.7, and like neutral is 7. So it doesn't need to be very acidic at all before we'll start to get some decay. And I think the average pH of Perth rainwater was about 5.9. So if you extracted a tooth and put it in Perth rainwater, it would likely decay, which I found a bit scary. But anyway. And the other thing that was significant was access to pasture. So horses that had access to significant pasture for most or all of the year, so I think it was more than 8 months of the year, were significantly less likely to have peripheral caries than those with minimal or no grazing. So grazing was a good thing, basically. So and then we're currently sort of looking at, we're doing another study that actually just got back. It's almost, hopefully, will be published soon. Looking at it histologically, so from a microscopic level, at what's actually going on in the teeth. And it's been really interesting because the condition, it sort of just affects the part of the tooth that's in the mouth at the time. So the part of the tooth below the gum is normal. And that's sort of, I guess, what's really exciting with this condition is that if we can figure out what's causing it and we can take away that cause, then it'll actually grow out, and these horses can actually recover, which is, I say, really exciting. And we've managed to achieve that in sort of dozens of cases now. So that's pretty cool, going from 10 years ago when we literally had no idea what was causing this, and we just had to tell people, sorry, your horse just has bad teeth, through to now being able to actually see these horses go back, and you can literally watch it growing out. We go back every 6 months, and you can see another sort of couple of mils of healthy tooth at the gum line just starting to grow down. So because their teeth keep erupting, we're very lucky in horses that we can actually cure this, basically. So it's pretty exciting.
Wow. If you're an equestrian coach or a horse riding instructor, or even if you aspire to be one, have a look at the free video series for horse riding instructors on the Horse Chats website. Go there now, have a look. horsechats.com. The other thing, and I'd like you to come back and talk to us about it a bit more, the volunteer work that you do. Because I think that itself is going to be, a really good podcast. I think that it's quite interesting, but it's also interesting what you do, what other vets do, what people can do to help. But just briefly tell us, that would be great.
Yeah, no worries. So, as I say, animal welfare has always been pretty central to, what I do. And, long story, but it basically ended up, going to the Gili Islands in Indonesia. And helping the horses there. So I've been going every year since 2014. I unfortunately didn't go this year because I've just had a little bub a few weeks ago.
Okay.
But other than that, every year we go and so we basically just run free veterinary clinics, and we also have farriers there as well to do their feet. So it's really nice to actually see the difference too. So as I've been going there for quite a few years, and when we first went there, they were all, in pretty poor condition. They don't give them water. They sort of used to just mix this sort of salty, brackish well water in with the feed. And because it was quite salty, it would then, basically destroy the liver and kidneys, and these ponies would only ever last a couple of years before they'd, be in deep trouble. So, there's some wonderful people on the island. The Gili Eco Trust has also been sort of organising, they've been putting water, like fresh water, running fresh water to the stables, so the ponies are getting proper water. And as I say, through the clinics and education, and we sort of talk to the drivers, obviously, and explain, how to sort of look after the ponies. The main sort of cause, I guess, of most of the injuries is actually from the gear. Their version of a bit is often, a piece of twisted wire or a piece of rope, had bits of baler twine, pieces of pipe, all sorts of stuff And a lot of them are very sharp and cause some really lip lacerations. Just obviously when the drives are also very rough with the pony's mouth, and it just slices the lips apart. So it's pretty awful. And so we take a lot of donations of bits there, to replace the awful bits. Also, when the leather breaks, they repair it with nails. So you basically have these nails sticking straight out into the pony's sides.
Wow.
Pretty awful. So
And is it that they just don't know? And of course, without having the money to repair things properly, but is it just lack of knowledge? Is that all it is?
Yeah, I think it's a bit of both, and it depends because there's obviously a lot of drivers and there's a lot of variation. A lot of it, I think, is education, and that's where I think it really is starting to make a difference now. And I certainly am starting. We are starting to see a big improvement over there. Just through constant education.
Yep.
And then some of the drivers are really lovely and really care about their ponies. And I mean, I've had one that had a skin condition, and I sort of said, oh look, this is going to need, we need to put on antibiotics for a good few days, and keep clean it every day. I said, look, we'd actually finished the clinic, but I said, oh look, just I'm still here for a couple of days. Just come in the morning, and we'll treat him in the morning. And I said, just come about 8 o'clock. And every morning he was there at 7:30.
Oh,
and
wow.
I'd sort of be rushing through my breakfast and say, no, you enjoy your breakfast. No, oh wait, that's fine. And just so lovely, like really, really cared about his pony, and would do anything for it. But there is obviously the other side as well, and there's plenty of drivers that I think pretty much just come for the free gear, and because we obviously do bring quite a lot of donations.
Yep.
And they really don't care about the ponies. Although as I say, I think that it's getting a lot less and a lot better. The first year I went, literally probably less than half of the owners actually brought the ponies to the clinic. Like we would even go around, we kept going around to the stables and asking the drivers permission to be able to treat their ponies, and a lot of them wouldn't even let us treat the ponies.
Wow.
And that's pretty awful when you're like, I'm a vet and I've spent thousands of dollars to come here of my own money to help your pony, and you won't even let me treat your pony. That was quite hard, but as I say, that's changed hugely, and I don't think there's pretty much now all the ponies come. There's very few that don't come to the clinic on their own, and so it's really it's quite different. And I think again just through the years of the education, and just we always try and keep it really positive. We don't sort of yell at the drivers for doing the wrong thing. We sort of say, look, just thanks so much for coming, and show them what the problems are and how we can help. But as I say, not trying to keep it in a positive and friendly sort of atmosphere, so they're happy to come back the next year.
Yep. And I think people at this stage can, find out more about that project on your website. Well, now, tell us the name of your website.
So just Dental Vet, so dentalvet.com.au.
Okay, so I think if you want to find out a bit more about that project, but hopefully we've got Kirsten will come back and tell us a bit more about the work that they're doing. I think really good. And not just the work that you're doing, but what other vets are doing in other countries as well would be really interesting, I think.
Yeah, because we do also, so I'm also a committee member on Animal Aid Abroad, which is a charity that sort of got me involved in the Ghillie ponies, and through that I also, then will sort of often give advice because they run projects all around the world, and so we have vets from India and Tanzania and all sorts of places that will, message. We've got WhatsApp groups for them all, and then if they've got any difficult cases they can message them through, and I'm happy to advise them and that sort of thing. So it's nice if we can sort of help out a bit that way as well, and just more horses and donkeys and camels that we can help, the better.
All right. Now, your contact details are going to be on horsechats.com/Kirsten Jackson, or just search for Kirsten or search for Jackson. But if anyone else would like the contact details for Dr. Kirsten Jackson, what have you got now that you can tell them? Have you got a phone number or an email or something, or should they just go to your website, which is dentalvet.com.au?
Yeah. So the website. Otherwise, the Facebook page. It's been a little bit dormant for a little while, so I've just had a bump. But I'll be heading back to work in January, so it'll certainly be revving up again then. So that's just Dental Vet again. So if you just Google in Dental Vet, type in Dental Vet, and you'll see the picture of the cartoon horse, and that's our
with a
our
huge
logo.
Smiley face, hasn't it? It's got a lovely big smiley face with lots of beautiful white straight teeth. They look gorgeous.
Yeah. So that's probably so the Facebook page, we try to keep that quite up to date and put a lot of interesting cases and things on there. So for people, if you're interested, we try to keep it sort of quite educational for people.
Yep.
So that's definitely a good place. Otherwise, email just Kirsten, so KIRSTEN @dentalvet.com.au is the email address.
Perfect. Now, do you travel out to any other places besides Western Australia? Do you go to any of the other states? You go to Gillies Island, but and you speak overseas. Have you got any plans to travel overseas in the next 12 months or 2 years?
I do. We do travel to. I've travelled to Europe at least pretty much every year or so for the last 5 years. Just for continuing education. There's a lot of wonderful veterinary dentists in Australia. But there's doing some pretty cool stuff over in Europe, and sort of really pushing the boundaries of what we're able to do. So. I've certainly travelled over to Europe for education, and they run quite good courses and things over there. But probably not to sort of live or work over there. I guess I'm pretty happy in WA, and pretty we get a bit booked up too with work in WA, so
okay.
Bit hard to sort of to go overseas, but and. I don't travel interstate, but there's lots of other excellent veterinary dentists interstate. So if people, if you've got a dentistry question, feel free to message us at Dental Vet, and we can, if I can't help you, then I can certainly recommend. I'm sure I'll be able to recommend some people in your area that will be able to help you.
Okay, then. Wonderful to talk to you, Kirsten. Thank you very much for your time, and we'll talk to you again sometime soon.
No problem. Thanks so much for having me.
Thank you. Bye-bye.
Bye.
Now, if you're still there, you probably know that I'm absolutely passionate about education within the horse industry. That's why I host this podcast. My other venture is Online Horse College. Have a look now at onlinehorsecollege.com, and I'll see you over there.
Remember that our comments and instructions are general in nature and do not take into consideration your individual horses or your individual ability and circumstances. If you enjoyed this podcast, then please leave your comment below.